Hi everybody, this is the second part of the lecture for Chapter 23, Vascular, Cardiac, and Interventional Radiology. Okay, I think we ended on anterior circulation, mainly anterior circulation in the brain. So this is a procedure that's done with neuro-interventional radiologists. Don't worry too much about projections, okay, or certain ways to do these exams. You would learn that in the cath lab if you were employed there, okay, so not to worry so much. This is just a general overview, okay. Two different types of cerebral exams, though, one for the anterior circulation and one for the posterior circulation when you're looking at different parts of that anatomy. Okay, next we're going to move on, and one of the common exams done in the IR suite are central venography. Okay, it's superior vena cava, so you're looking at the aorta up on the top near the lungs and the heart, or you could do specific imaging and look at it down lower for the inferior vena cava. You're ruling out blood clots or occluded veins, and most likely they wouldn't use this for the peripheral veins, arteries kind of thing. You could see some from filling defects or just from time, but most likely you are just looking at the vena cava itself. Okay, the superior vena cava is performed by accessing the axillary or subclavian vein, and that's where they're going to access it and inject the dye. The inferior is accessed by the femoral vein, placing a catheter in through the common iliac vein. Okay, other procedures in the IR suite. There's something called PTA, which is a percutaneous transluminal angioplasty. What that is just going into a vessel and reopening a stenosed or occluded area with catheterization and using a guide wire and putting either balloons or devices that they can go in and expand vessels. Okay. Next is the transcatheter embolization, and we talked a little bit about that, where they'll go in and they will cut off blood supply either to a tumor or aneurysm with coils. Next is inferior vena cava filter placement. So we're going to go through, we'll show you a picture of that, of what a filter looks like, and what that does is catch blood clots coming from down in the lower extremities up, back up towards the heart. Next is TIPS. That's a transjugular intrahepatic shunt. Okay, and moving on. So the first one is that PTA. So they're going to go in with balloons and stents and try to open up occluded vessels. Okay, and this is a great picture of a before and after of how the blood flow is improved. Okay, next is that embolization, and this is where they'll go in using catheterization in the IR suite. They'll go in and they'll find an aneurysm on a previous scan. They will demonstrate the aneurysm with contrast before they do anything, and then they'll go in and they'll feed some catheters up there with the guide wire system and try to block blood flow by embolizing that area. And this is an example of an aneurysm that they have used coils. And this bottom right picture is just an example of what a coil looks like. Okay, next is that inferior vena cava filter. This x-ray is a good picture of a vena cava filter inside the inferior vena cava doing its job. So it's just sitting there. It's splayed out, and any blood clots that come up from the lower extremities, deep vein thrombosis, things like that, that break free and come up and travel towards the heart will be caught by this filter. And this diagram just shows you a little simplified diagram. Okay, a TIPS procedure. So this creates a pathway between the portal and hepatic veins. It is used on people that need their blood pressure lowered, and it has been determined that their high blood pressure is due to portal hypertension. Okay, it's affecting their liver at this point. It's associated with bleeding in patients with liver disease, and TIPS is usually performed after they've done a venogram to see and demonstrate these vessels. Okay, other procedures done just include The thrombolytic therapy, we talked a little bit about that, where they're going to inject some lytics into the patient to try to dissolve and break apart blood clots so that your body can break down the little pieces. And they also mention here that foreign object removal is done in the IR suite. So you could have some kidney stones that are not passing themselves, and they can go in and try to retrieve those. Okay, next we're going to talk about the cardiac cath lab. Okay, the definition, a comprehensive term used to describe a minor surgical procedure involving the introduction of special catheters into the heart, specifically great vessels and coronary arteries. Okay, both diagnostic and therapeutic treatment can be performed in a single procedure, and what that means is you might come in with a heart attack and they notice something on your ultrasound, and they put you in the heart cath lab and they do a catheterization and inject some iodine dye, and they see that your coronary artery is occluded, and they know that you need a stent so that they can do it at the same time. They don't have to re-anesthetize you. You're already under. They don't have to prep you again, introducing any more germs and the risk of infection. So everything can be done at the same time. Okay, so identifying anatomic and physiological conditions of the heart. Coronary angiography is the most definitive procedure for visualizing coronary anatomy. Okay, so that is the gold standard right now for heart imaging. Okay. Information from coronary angiography includes presence and extent of, and this is just general indications, you guys. So you're going to see obstructive coronary artery disease, you're going to see blood clots or thrombus formation, you're going to see coronary artery collateral flow, and that just means if one of your coronary arteries has decided to grow additional blood flow, and lots of us do, it's going to illustrate all of those collateral arteries. It's going to show any anomalies. It's going to show an aneurysm. It'll show a heart spasm, and it'll show the size of those vessels. Okay, hemodynamic data can also be obtained. Don't worry about that. Interventional procedures such as angioplasty and stent can be performed during the single procedure, and we had just talked about that. Okay, this is a good example of a before where they are totally occluded. That left coronary totally occluded. That's actually the right coronary totally occluded, but the left is also gone. So it looks like both of them. And then they've reestablished that right coronary. Okay, relative contraindications. Even though this is termed a minor surgical procedure, and that's why it's allowed to be in the catheterization lab instead of in the surgical suite, there are risk factors involved. As with anything when you're injecting foreign substances or having someone under anesthesia, there are risks. Okay, contraindications to having any kind of procedure where you're tapping into a vessel. As we know, the #1 risk factor is blood loss. Okay, so any active GI bleed, that's a contraindication for this. Chronic renal failure, another contraindication, most likely because of iodine contrast. Recent stroke, fever, severe electrolyte imbalance, severe anemia, short life expectancy because of other illness. So this is just going to tax your system to the point that it's too risky. Digitalis intoxication, but the only absolute contraindication is the refusal of the procedure by the patient. Okay, contraindications continued, patient refusal, severe uncontrolled hypertension, so they just can't get the blood pressure in line. That can cause heart issues when you're under. Okay, bleeding disorders, or your blood will not clot. Okay, so coagulopathy, acute pulmonary edema. So anytime that the lungs are not performing optimally, you don't want to put someone under anesthesia. They can fill with fluid. Uncontrolled ventricular arrhythmias, so your heart muscle is not conducting the electrical impulses correctly. Aortic valve endocarditis, and this just means an inflammation of those aortic valves. So another indication that your heart's going to get too stressed out, and previous anaphylactic reaction to contrast. So, of course, if you're allergic to iodine, this is not going to work for you. Okay, main predictors of major complications. So say the patient didn't have any of those other risk factors, but they still could have one of these predictors that are going to show that they might survive the procedure and get through the procedure, but they're going to have complications when it's done. One is a moribund patient. That just means a patient that is at the end of their life cycle. It looks like they're not going to recover. They're at the end, no energy, no motivation, kind of like failure to thrive. Just too sick, actually. Cardiogenic shock, acute myocardial infarction. So if you've had a heart attack within 24 hours, that is a major factor that you could have complications at the end. Renal insufficiency and cardiomyopathy. Okay, the cath lab requires specialized equipment. So you can't just do heart catheterization in the same room as the IR suite. They require special equipment, special supplies. It's similar to those used for other vascular studies, but they're unique for coronary arteries because coronary arteries are a lot smaller, so they need better equipment or high resolution equipment that takes images quickly. Cardiac procedures require extremely short exposure times just because of that heart motion. Okay, rapid exposure sequencing, which is 15 to 30 frames per second. Nowadays, it's faster than that. Okay, and that is great for heart imaging. High resolution is needed to image these teeny little vessels, collateral vessels especially, and then long-term storage of all of that digital data. Okay, you're going to have built-in monitoring equipment in a heart cath lab as well. ECGs and your blood work, your blood functions. Okay, you're also going to have specialized crash carts there in the heart cath lab. Okay, pre-catheterization care, I would not worry too much about this. This is just extraneous information. Okay, catheter introduction, as we know, usually will go in through a large vessel, one of the largest vessels that we have access to without major complications is the femoral. Okay, so that's most common introductory site for any kind of catheterization procedure, although we also use radial, brachial, axillary, jugular, and subclavian, depending on the patient, depending on what procedure that they need to have done. But know that the most common introduction site is the femoral, okay? Certain data is essential regardless of what type of catheterization is included. So the data collection that they are doing is physiological monitoring, okay? And that, like I said before, that's usually built into catheterization suites, into the software. Okay, more information on just monitoring. Okay, some basic diagnostic studies in adults in the heart cath lab would be left and right-sided heart catheterization. These are just the diagnostic studies where they're injecting contrast to see what's going on with the vessels. Children, they're going to look for a congenital heart defect if they have suspicions of certain things with ultrasound and chest x-rays, etc. They're going to be able to go into the heart cath lab and see some better pictures. The procedures, of course, will vary with their age and their heart size and things like that. Okay, advanced diagnostics of the vascular system. This is where we can go in and help patients out. So the basic diagnostic imaging has been done, and now they can go in and do procedures. Instead of opening up chest for open heart, they can go into a heart cath lab. Much safer overall. The first one that we're going to talk about is the endomyocardial biopsy. This is mainly for people who have had heart transplants. They're monitoring for rejection, or they are trying to get a diagnosis for some kind of pathology or disease of the heart muscle. So they can go into the heart cath lab, they can insert a catheter and take a scraping or a biopsy of that heart muscle. Okay, also in children, they will go in and they can insert a little balloon into a heart hole in the wall of the heart. Most people, this heals on our own as we grow. In some children, however, it does cause complication. It does not heal properly, or it's too big. You can go into the heart cath lab, less risky than open heart surgery, and just insert a little balloon or device that blocks that hole so that the child can have better heart function. Okay, adults, we have already talked about this. We can go in and you do stents. We can go in and do therapy to break up clots. We can go in and do an atherectomy, which is the sharp blade on the end of the catheter to break up an occlusion. And intravascular ultrasound, they can go in and see how the blood flow and structures are doing with catheterization. Okay, this is another picture of a balloon atrial septostomy, and that's where they will go into children and plug up the hole in the walls of the heart with a balloon, and you can see the balloon on the image. Okay, lastly, a couple additional procedures for adults and children. They can go into the heart cath lab and install pacemakers. That regulates the heart rhythm. They can put in defibrillators to prevent atrial fibrillation, okay, by shocking the heart. They can also go in and do radiofrequency ablation. That's where they're going to go in and do some kind of heart block. Maybe the electrical impulses of the heart are going awry, and this tries to get them back onto the correct path so that the heart functions correctly. There's many other procedures that are performed in the heart cath lab. There's electrical conduction. But this is all that we're going to review. This is a lot of information on this chapter. I realize that you guys did a great job. Just go over these slides, know your basic anatomy, and you should do great. Okay, thanks.